here at Policy Exchange. And it's my really great pleasure and privilege to welcome you to this next event in our conference programme this year. And the question that we're asking is, how can the government meet the health and care needs of an ageing population? And I'm delighted to say that we've partnered with Age UK for this event. So this discussion is considering the changing burden of illness and needs in society over the coming years. We know that half of people over the age of 55 have at least one long-term condition, and that goes up to 80% for people over 80. So more conditions that people are managing, more frailty. Now, pressures on the health care system in recent months have reinforced really the interdependency of social care to the NHS. And so thinking really carefully about how the government can effectively deliver on that vision of joining up services across the health and care system to reduce pressure upon hospitals and to better meet the needs of patients is key. So to consider these questions and more, I'm pleased to say that we've assembled a really, really fantastic panel. My left, Helen Whately is the Minister of State at the Department of Health and Social Care with particular responsibilities for care, urgent and emergency care. This is her second stint as care Minister. Previously served as Executive Secretary to the Treasury and was previously Arts Minister and has been the Member of Parliament for Faversham Mid-Kent since 2015. To my right is Stephen Chandler, and he is the Executive Director of People at Oxfordshire County Council and a former President of the Association of Directors of Adult Social Services, ADAS, a position that he held from 2021 to 2022. And he was previously the National Policy Lead for mental health at ADAS and also served as its Vice President. And he started his career as a mental health nurse and has also worked in several NHS roles too. I'm delighted to say that joining us remotely is Professor Jagdeep Desi. She is a consultant geriatrician at Guy's and St Thomas's NHS Foundation Trust and Professor of Geriatric Medicine at King's College London. And she's also the President-elect of the British Geriatric Society, and she's going to become President in November 2024. And her clinical work really focuses on improving outcomes for older people undergoing elective and or emergency care. And lastly, not least, is Paul Farmer, my far left, the Chief Executive Officer of Age UK, which is a position that he's held since October last year. Before joining Age UK, Paul was the Chief Executive at Mind, a mental health charity working across England and Wales. He's also a Commissioner at Historic England and Non-Executive Director for NHS Frimley Integrated Care Board. So it's a pleasure to welcome all of you. So I'll be handing over to each of our speakers in turn in a moment, starting with the Minister. And they're going to be delivering up to 5 minutes of opening remarks. And then we'll have the opportunity for some discussions of the panel, some of the more salient points. And then it's over to you for the final 15 to 20 minutes. And our house rule here is that you must state your name and organisation before you ask your question. And also you must have the mic in your hand. Don't just shout out. So without further ado, please over to the Minister.
Thank you very much for that introduction. I will try really hard to stick to 5 minutes on a topic that there's tons I would love to say. But as you set out a bit at the beginning of that introduction, the health system and the health and social care system that we have today needs to do something very different than, say, back in the 1940s when the NHS was founded, when life expectancy was to live to your mid to late 60s. And now you're much more likely to live into your 80s. A wonderful thing to live longer, but what we know is the reality of living longer is that you are also likely to suffer from ailments, and that as you live into later life, you're more likely to have long-term conditions. If you're over 55, you're likely to have at least one long-term condition. As you live into your 80s, you'll have multiple long-term conditions, and you may need a significant amount of healthcare. One of the things that we see at the moment, and I see as a minister and all of us who work in our health system see, is too often we are seeing older people going in and out of hospital and not necessarily actually really getting what they want out of our healthcare system. And also we know that places real pressures on hospitals, most obviously, and we see very busy emergency departments, difficulty discharging people, and so it's putting real pressure on the resources of our health system. But also crucially, it's often, I mean, there are clearly times when people should be call an ambulance, go to any, be admitted to hospital, but often it's not the best care, the best place that somebody could be. And so what we need to do, is a better way of doing this. And I'm absolutely convinced that the better way is better for our health system, more sustainable for our health system, and better for people. And it's about caring for people more out of hospital, and it's about whether it's more prevention or more proactive care to help people live independently, be more in control of their own health care, and be able to maintain their health, or when they have a health crisis, much more often for that to be supported out in the community, closer to home, or indeed care in their own home. Now, many of the answers to how we do this are actually already out there. It's one of the things that I'm so well aware as a minister, is that the answers are not generally sitting in Whitehall. The answers are sitting out across our health system already. The hospitals at home, or virtual wards rollout that we're doing at the moment, building on great examples of where already we see some fantastic care, hospital-level care, that people can get at home, and that helps people to be discharged more quickly, but also can help people be admitted in the first place. Another model which I'm keen on, and working with NHS England to take national, is community-based proactive care. Sometimes it's called anticipatory care, proactive care, community teams, neighbourhood teams, multidisciplinary, different words to describe it, because it is being done in slightly different ways in different places. But in essence, this is a fantastic model, and there's a great example in the Jean Bishop Centre in Hull, where the GPs in the community identify people who are frail elderly, most at risk of coming in and out of hospital, and then they're seen by the staff of the centre, multidisciplinary team, who identify what support they need and how best they can be helped to stay living independently and reduce avoidable admissions to hospital. And that's actually now available both to people who live at home and also those in care homes, with some fantastic results. So the admissions to A&E from people in care homes have fallen by a fifth as a result of the work that the Jean Bishop Centre is doing. And overall, the admissions from people who are over 80 are down by 13%. So these are material shifts, both for the experience of patients and for making the better use of the resources in our health system. So we know, and there are other parts of the country which are doing similar things. So my view is, we know that those sorts of things really work. The big question is usually, how do we make it happen? How do we make that happen so that everybody, if you're frail, elderly, wherever you are in the country, how can you get access to that kind of service? For which I will touch on integration and joining up, which I think was one of the things that was a prompt of a part of the conversation today. Because some of making this happen is through joining up our health and care system. And to me, a crucial part of that is the role of integrated care boards and integrated care systems. And I'll try and avoid going into a lot of acronyms. But the ICBs and ICSs are looking at the health of a population and saying, how do we make the best use of our resources across this population? And to me, that's crucial, because then you're in a position to step back and say, well, okay, we know that we need our hospital services, but actually we really need to invest in our community healthcare services, and we really need to make sure that mental health has got the resources they need. And we need to look across, and okay, let's look at what we need for social care as well. And looking across the population, that's a way of saying, okay, well, let's really invest in these kind of community-based, multidisciplinary, proactive care services. So I think what happens at a system level is really, really important in directing resources. At a government level and a national level, we have absolutely a part to play. I've been working with NHS England on, so we get into the terms of frameworks, but essentially a proactive care framework for this kind of model of care, which actually has also involved Age UK and the British Geriatric Society which I'm sure Jagdeep can give a fantastic perspective from. But bringing together the expertise on, well, what does this model look like, which will be published soon. But then it's up to every area to be able to put that into practice with, of course, the support from the centre to achieve this shift from the traditional model of everything looks to hospitals to actually, of course, hospitals have got an important part to play in our system, but really we have to be doing more out of hospital, more helping people live well, live independently with the support that they need, the access to the care that they need, but having a better quality of life and meeting their needs. And so I truly believe that's better for patients, for their families, and also it's what will give us the sustainable healthcare system that we need as we have an ageing population.
Brilliant. Thank you very much. An excellent introduction. So, Paul, if we maybe turn to you next, and then I'll invite Stephen, and then lastly, Jagdeep.
Thanks very much, Sean. Good afternoon, everyone. It's really good to be here. Over the course of the last year or so, I've been travelling up and down the country visiting our local Age UK partners. I've been to about 30 of them, and I've met older people in every place that I've been to. And in those conversations, I've heard a series of very clearly repeating themes. And they describe, I think, a very real challenge that our older people are facing at the moment. So first of all, we mustn't forget that long shadow of COVID that still casts a really significant impact on many people's lives. Many older people still at home, struggling to get out, either because they've lost physical capability or because they've lost the confidence and will to be able to go out. Add on to that, as you've heard from Helen, the growing number of older people needing to use A&E, and nearly half of ambulance arrivals are people over the age of 65. And something I've really seen is particularly the effect of the challenges that the social care system is facing at the moment. As eligibility goes up, older people find themselves in a far greater state of need, quite often falling into the system as a result of quite literally sometimes as a result of a fall, needing to go to A&E, then being picked up and then being identified as in real need of significant help. And of course, as waiting lists increase, the majority of people on those waiting lists are also older people. So I've heard time and time again from older people telling me that they're concerned, they're frustrated about the very significant needs that they have for their health and care. And so this is an immediate problem that many older people are facing this winter. But Helen's absolutely right to also highlight that we have longer term challenges as well. And tackling that ageing population question, which I think for some people maybe feel is in the too difficult box, but absolutely has to be addressed in the here and now. That reshaping of a population as our older population increases. The Health Foundation's report for healthcare in 2040 will see 2.4 million people with million more people living with a major illness. 2.3 out of those 2.4 people will be older people. And it's a different generation of older people. It'll be the generation that have been brought up on punk rock and Kylie rather than the Vera Lynn generation. So we need to think differently about our older population. And then, of course, there's the inequalities challenge, with many people from many communities not likely to get to their 80s or 90s as their life expectancy reduces rather than increases. Now, I mention both of those because they are, in some cases, short-term issues and in other cases, longer-term issues. But I think there is a clear consensus that the solutions actually arrive at the same place. You've heard about some of them, and I think there is real consensus in the sector about where we should be applying our thinking. We need to be applying that thinking into prevention and early intervention. The best conversations I've seen have been the conversations with people, helping people to think about their physical activity, thinking about engaging in turning up at walking football events or taking part in health checks, other opportunities to sustain good health over a period of time. But some of the great ideas, similar to the idea in Hull that you've heard about, to also identify those groups of people who perhaps are at greatest need, where a more specific intervention might be needed. So again, examples around the country of GPs identifying the top 100 people in their profile list who need maybe more specific help, intervention and support. Secondly, the need to address home-based support. It's a conversation that probably most people in the room would absolutely subscribe to. So the question is, why isn't it happening? We'll come to that in a second. Thirdly, connected to that, community-based solutions. And I think the role of the voluntary sector in this is really strong. I've been so impressed by seeing not just at Local Age UK's, but other voluntary partners as well, really creating that kind of wraparound support, complementing the support from social care professionals and NHS professionals to create those solutions. And connected to that, the help and support and investment that is needed in local government. And I have a funny feeling Stephen might be talking a bit about that in a minute. And then kind of finally thinking about the pace around this question. I think over the last few years, we've increasingly seen the kind of challenges that older people facing increasing. So this winter then becomes a really critical period for so many older people. And I really hope that the plans that are beginning to emerge for older people, for the population generally, are really focus on older people in this coming winter. So how do we get there? Well, I think first of all, it's really important that we listen to the voices of older people about what people really want, what they need. I think quite often that voice is not quite strong enough. We're here to amplify that voice, make sure that voice is really clear. But when we listen to older people, what we hear time and time again is they want to stay at home for as long as is humanly possible, and they want to have that support wrapped around them in whatever way is most appropriate. And I've met so many older people who just tell me how important their home is to that. But I've also heard older people telling me about the help and support that they got only after a crisis happened. They had a fall and then the rails turned up, rather than actually the other way around, thinking about how we could create that anticipatory care model that you've already heard about. I too am a big believer in the potential of integrated care systems. We have to remember these are toddler organisations. They're 1.5 years old. And maybe some of them are behaving a little bit like toddlers as well. So we need to think about how we give them the space and the time over a longer period of time to mature. But if ICSs are really going to be worth their salt, that principle of connecting up primary care, the voluntary sector, public health, social care, mental health services, and community services, in other words, everything that doesn't happen inside a hospital, to create a set of services that are as powerful and as effective as the way that people perceive hospital services, is a really important opportunity for that change. And that's going to take time, because this is a revolution to achieve that, but it needs to be sustained over a longer period of time, I think. Finally, you'd expect me, given my background, to talk about mental health. I think the mental health of older people is often ignored because the language is often different. Often many older people I've been talking to are talking about isolation and loneliness. And what often I'm hearing is anxiety and depression. And the need for us to invest and support the mental health of older people is increasingly important. We're seeing both locally and nationally from our services an increase in calls from older people who are suicidal, who require safeguarding referrals, and that's an increase in numbers over the last couple of years. We have to pay attention to that. And we also have to pay attention to those people who experience the greatest inequalities in our community. And those programs have to be invested in as early as possible if we're going to achieve this place where every older person can genuinely say they're feeling comfortable and confident about the health and care they support. Thanks very much.
Brilliant. Many thanks, Paul. So, Stephen, over to you.
Thank you, and good afternoon, everyone. I'm going to try and avoid repeating what either Helen or Paul have said, because I haven't heard anything from either of them that I disagree with, so I fully support what has already been contributed. So the question was, what can government do to help the health and care sector? I'm not sure that's necessarily the right question, because I think there's a more fundamental question, which is, what can we do to help the health and well-being of society? And then what is the role that government plays in that? Not relying on the government as being the starting point for that discussion and debate. So I think whether you couch it or describe it as part of a prevention agenda, I think we need to have a much broader conversation around what personal responsibility each of us have, what responsibilities we have as members of families, what we have as a responsibility in the communities that we all live within, and indeed that broader societal responsibility. One of the positive things that came out of COVID was the real value of each and every one of those. So we heard fantastic stories about individual success, family success, but most importantly, we heard a lot of success from communities coming together, whether it's that Churchillian spirit or whatever it was. It brought people together to look after each other. And I think we need to have much more conversation around how do we help us all remain healthy and well. We then need to ensure that we are targeting prevention, not at people who have become ill. I was sharing a rather humorous personal story a little earlier where my GP, because of my age, have now started to contact me to remind me that I'm due a health check, which is great. However, they refer to it as a multi-disease review. Now, I am actually in good health, so I don't have any, to my knowledge, underlying diseases. But it has to be more welcoming than that, you know. It hasn't put me off, and I will go there. So it is then about helping us in less traditional ways. So I know when I go to have my health check next week, it's likely to tell me that my blood pressure is slightly elevated. Now, as Emily said to me, that might be to do with your job more than your underlying health need. But there is a real risk. My GP will say to me, we want to start you on a small dose of a blood pressure treatment. What would stop the GP saying, can we provide you with some vouchers for some fruit and veg and maybe a voucher for access to your local gym? Now, you might say to me, Stephen, you should be able to afford that yourself, and you're absolutely right. But I'm not drawing on the resources in the NHS. There is a resource attached to the drug that I will get for my high blood pressure. So I think we've got to be much more creative in how we think about the support interactions that we provide to individuals. Moving on, Paul understandably talked about the anxieties and concerns that older people have. I spent yesterday talking to parents of young people, and they talked to me about the worries they had for their young people moving into adulthood. These were young people often with disabilities, with severe underlying health needs, special educational needs. We need to think about society in that broadest possible view, not just through the lens that comes with illness and infirmity, in no way dismissing the importance of that. So that means we have to look at what those contributors to health and well-being are that we perhaps don't always start with. Employment, leisure, Paul's mentioned, and I'd reiterate, housing, all of those things that you and I probably just take for granted that are key contributors to our health and well-being. And this is in a way where we all have a responsibility, but where government can help by ensuring that those contributors to good health and well-being are as loud as the public health messages. So again, moving on, we've also got to, and Helen talked about a number of new and innovative models of support. We've got to really push the role that innovation has in health and care. And it's not just medical innovation, it's not just the innovation that comes with new drugs. It's completely new ways of looking at how we provide the support that people need throughout their life course. I had a conversation just last week with colleagues around what role will AI play in adult social care in the next 5 years. And they sort of looked at me blank. Now, I have the luxury of working in Oxfordshire, which is often cited as the centerpiece of innovation and that. So you know, we need to constantly push the boundaries rather than think, how can I make this piece of support as efficient and as effective as it can be? We've also got to make sure that some of the tools that are available to us today are more effective. I've sat on my local integrated care board as the local authority partner member. You heard in my introduction, I started my career in the NHS, half in the NHS, half in local government. So in a way, I'm a product of integration. But if you look up and down the country, some systems have really embraced innovation and integration. They have large pool budget arrangements, they're joint commissioning, they are delivering services that the public see as seamless. And there are other parts of the country that they've just done the minimum. My colleagues may not thank me for this, but this is where I think government should take a stronger hand in saying, these models that work, that are in operation in Leeds, in Somerset, in Oxfordshire, have to become the norm. And you have got to describe to me why you can't make that the norm to be allowed to have that, rather than if you're keen and you want to do it, the tools are there. So I think we have to be much more targeted around integration. And then finally, and I really was going to mention it without Paul's prompt, we do have to talk about the economic case, not just in relation to the need for investment, but in relation to the value that that investment brings to communities, to societies in the broadest sense. I don't talk about the demographic time bomb that exists in the community that I live and work with, because I'm less worried about the impact of older people. I'm more worried about the impact that Helen referred to of older people with 2 and 3 complex conditions and the cost of meeting those needs. So in Oxfordshire, we've had 300 people in addition over the last 5 years added to our list. So numbers is not the challenge. The challenge is the complexity of need of those individuals that we're supporting. And this is why we have to ensure that there's a long-term financial settlement for health and social care. Because again, you can't fix the care sector by investing in the social care sector without doing similarly within the NHS. So strong investment, a real push for innovation, but fundamentally a real debate around the responsibilities that each and every one of us have in our roles as individuals, as members of families, communities and society.
Many thanks, Stephen. And over to Jagdeep.
Thank you very much, Sean, and for providing the platform today to discuss this really important issue. And certainly kind of many of us, including Paul and members from ADAS, have all been emphasising the need to deliver a joined up and integrated health and social care system for many years now. And that's because those of us who work in health and social care, our older population. In fact, of course, all of us know that at 40% occupied by people aged over 65. But the issue here isn't so much just the group of patients, the numbers of patients who are presenting to us, but also the complexity. And as we've been hearing from Helen and from Paul, of course, the majority of our patients aged over 75 live with multiple medical conditions and with syndromes such as frailty and dementia. And the impact of these medical conditions is that older people often need support with day-to-day living, whether that's in terms of their shopping, cooking, cleaning, or whether that's with personal care in terms of feeding, toileting, and mobilizing. And many live in isolation, experiencing loneliness, but as Paul said, also anxiety and depression. And so with all of this information at our fingertips, it's really been painfully obvious that we can't disentangle health and social care, but we need instead to have a joined up approach to reduce the pressure on our systems right now, but also to better meet the needs of our future population. So what have we been thinking about at the British Geriatric Society in terms of the solutions? Well, we think that we do need to create capacity here, and that's partly through addressing demand, but also through supply as well. And in some ways, this requires two parallel streams of work. And kind of our colleagues have already addressed the issues around the preventive agenda. We do need to ensure that our population ages well, so that we have a different population that we're looking after in the coming years. We've got to ensure that we're educating our population across all ages around healthy lifestyles, but then that we're supporting them through public health policies to ensure good nutrition, smoking cessation, reduction in alcohol, weight management, physical activity, and leading meaningful lives through employment and engagement in their local communities. And actually, this requires braver policy making and investment in public health and communities than we've seen to date. And maybe the nudge approach over the last 13 years hasn't really worked in pushing the public health agenda. But on the other hand, we've also got to think about our supply and flow, and we need to adapt our health and social care systems to the population who are most in need of health and social care, namely older people. This clearly requires transformation of our workforce, our services, and our infrastructure. And in terms of our workforce, certainly most people who work in health and social care will come into contact with older people in their day-to-day work. And yet we don't provide training in geriatric medicine for all healthcare and social care professionals, and this needs to change. We do need experts in older people's care. We don't accept as a society that our children would be looked after by doctors who weren't paediatricians. And yet we expect our older populations to be looked after by non-experts. We need more geriatricians, and we need them to be available across the country. We do need an extended and blended workforce to be able to deliver this efficiently. And there's been great strides made in advancing roles for nursing and allied health professionals. But we do need to think about making sure we're using this workforce efficiently across those different sectors. And we need our domiciliary and social care workers to be recognised for the very difficult work that they deliver in our communities, recognised financially as well as in terms of status. How about transforming our services? We've already heard a little bit from Helen about this, as well as from Paul, and the fact that, of course, we know that older people have much to gain from assessment, investigation, and hospital-based treatment. But we also know that these interventions aren't always beneficial for older people, and sometimes they can actually cause harm. And to reconsider this, we need to have more honest conversations with patients and carers about realistic choice and what matters to them, so that we can establish services which are age-attuned and person-centred. And certainly we've heard already from my co-speakers about how some of these services are being established through working with integrated care systems and boards, with the voluntary sector, as well as with health and social care partners, community-based centres, hospital at home services, front door frailty services, enhanced care in care homes, and effective rehabilitation services. But as we also heard, these aren't being implemented consistently across the country. And that's what we also need to do is, as we've heard, not just encourage people to be setting up innovative practice, but to be taking this on systematically across the country to reduce geographical variation. And then finally, infrastructure. Hopefully this computer isn't cutting in and out, but it is interesting how many of us work in centres functioning, let alone making sure that all hospitals have access to electronic healthcare records and that those systems are shared across community and hospital centres. And we need to also, of course, kind of consider AI and where that fits in. So I think at the BGS, we're very clear about what needs to be in place to deliver joined up integrated care both now and for the future. And we are also very clear that we need to get this right for older people if we're going to get this right for the NHS as a whole, in view of the issues that we've seen in terms of flow. But we do need clarity of leadership at the Department of Health and with NHS organisations to develop and critically implement these policies into a national approach, reduce geographical variation, and address the health inequalities agenda that we see, particularly affecting our older population. Thank you.
Super. Hopefully you can hear our applause, Jagdeep, from everyone in the room. So perhaps maybe if I pose a sort of question to each of our panelists, but also when you respond, do feel free to respond to any thoughts that have been prompted by points made by the other panelists. Minister, I think you've set out a really positive case for proactive care. And we look forward to seeing the details in due course. And I think there is consensus on the panel on the overarching sort of direction of travel. I just wonder from your perspective what the high impact enabler, or what the biggest challenge from your perspective to actually delivering that vision is going to be. There's obviously the news that we've heard from the Secretary of State's speech today about that additional funding being made available, which for virtual wards will be something ICSs will be able to draw upon. We've had this point around skills mix and the workforce dimension. I just wonder from your perspective what the high impact enabler would need to be.
Very happy to talk about that. And actually, as I do so, and pick up on, I think both Stephen, you said about we know the models that there are which lead to better joined up care, and you kind of a call for these to become the norm, and if not, why not? And Jagdeep, you also sort of talked about more sort of pushing for a national approach. And to me, actually, there's always what's a right path to tread between knowing it, as a minister, to say, well, everybody across our whole system will do this in this way. It's like, well, actually, the reality is there is, diversity, and different systems have different legacies and different things, different involvement, for instance, in the use of the voluntary sector. So it's not a single, you must do it exactly this way everywhere, but there absolutely is a job for us at the centre to say, this is broadly the models that work. Here are some examples of where they're up and running, and we expect you to be doing something like this. And we're doing a lot of that at the moment under the auspices of the Urgent and Emergency Care Recovery Plan, putting in place, for instance, care transfer hubs to support better discharge of people from hospital. And we are expecting every single system to have a care transfer hub that does bring together people from the acute sector and the community sector and from social care and from the voluntary sector. And yes, it will be done slightly differently in different places, but there is absolutely every area needs to be doing this. And if it's not 7 days a week, which it isn't everywhere, I mean, I'm literally, I want to know, is this service 7 days a week in every, or if in that area it's only 5 days a week, well, kind of, why not 7? So we are doing quite a expectation that of relative consistency on that at the moment. For the models, the proactive care and the population health management, I think one of the challenges is probably a bandwidth one. There's a lot going on. So we're doing the care transfer hubs, as I mentioned, virtual wards or hospital at home, on track to have 10,000 places, sort of hospital at home places ready for this winter for that. So that's going on. So it's then, and then we say to the system, okay, we want you all to have a proactive, community proactive care model for frail elderly. I think so. I would love everywhere to have that, up and running for this winter. There's a bit of, actually, there's so much to what we're asking of so many people. So some of it is just allowing the system a bit of time, and so I think that is one of the challenges is sort of one of bandwidth and so much going on. And of course, with winter approaching, and that just puts pressure on the everyday. So managing to deliver every day while also changing and moving to different models is difficult and takes time.
Thank you very much. One of the things I was really struck by in your opening remarks, Paul, was the notion of social care being in the political category too difficult. I just wondered how we might break the deadlock on that.
Well, I think we have to, because every year or 5 years that go by, people's experiences are deteriorating. So we just can't ignore it any longer. I mean, I think I'd encourage all politicians of all parties to do the brave thing in their manifestos and be clear about their ambitions for social care. I think I recognise that's a difficult thing, but we've certainly seen polling that suggests that the public are actually ready for a conversation about this, because perhaps they've seen their parents or grandparents not really getting the quality of care that they've expected. And so many people don't necessarily know what's going to happen until it happens to them or a member of their family. But when they do, then it's not a good enough experience for too many people. So I think there is an opportunity to really listen to people about this and to think about how we shape a conversation for the next 5 years. It's a long-term solution that is required. It's probably there's a bridge over the next 5 years that perhaps politicians will be able to do in their manifestos, and I'd encourage Helen and colleagues to do that. But actually to think about a long-term solution that will see the level of funding that's required. And I think particularly thinking about the workforce, and I know there's a lot of work been gone into already about thinking about the workforce and thinking about supporting and really kind of enabling a kind of better narrative for the social care workforce, who do phenomenal work in incredibly difficult circumstances. And I think really thinking about a kind of a really strong career trajectory in social care, I think is really important to start if we're going to start to change that narrative. So those are 2 or 3 routes I think that would be well worth considering. And I think just coming back to Helen's point about, or in fact your question to Helen about the high impact enabler. I mean, winter drives so much change in the NHS, and I think the opportunity this year, particularly for ICSs, is to capture the learning from what they do this winter into creating a much better sort of set of lessons for year-round approaches to how we tackle things like surge and discharge and transfer hubs. I heard many local age UKs standing ready to be able to deliver that kind of help and support, but waiting for the green light from the Commissioner to do that. And that's frustrating for everyone, because we know we're ready. We know that organisations are ready to stand up. The later it goes on, the less likely they are to be ready. Essentially, if you can get those green lights on the move now, then I think that the experience will be better. And you can also put in place better evaluation to show what works within a particular community, where you have got a different, you'll have places where there's strong carer involvement, have places where there's strong voluntary sector involvement, and so on. So the equation will be slightly different. But I do think there's a framework that can be populated this winter that can really take us into future winters and future years in a much more effective way.
Many thanks. Stephen, I was really drawn to your comments about, alongside the types of reform and emergence of proactive care models that the Minister has set out, this idea of personal responsibility. And it was interesting also hearing Jagdeep's remarks about nudges potentially having not been enough in terms of driving the types of changes that we need to see with a sort of growing and sort of changing burden of illness in society. I wondered what those personal responsibilities from your perspective would look like, and sort of what those familial responsibilities would look like.
Really, really good question. And just before I get to that, just 2 comments on what the Minister and what Paul said. I think in every system, one of the most critical things that we need is really clear, strong leadership. And it's not NHS leadership any more than it is local authority leadership, than it is voluntary sector leadership. It is system leadership, where the leader looks at the needs of the population, which is why I'm very excited about the role that ICBs bring, because they really should be looking at their population through that lens. I was talking to the chief exec, the ICB chief exec from Lincolnshire last week, and he was a fantastic example of someone who looks through the lens of population, his population, and the pride he had in the work that he was doing in that area. It is also salutary that only 14% of the people who responded to the British Attitude Survey earlier this year said they were satisfied with social care. Only 14%. Now, I don't know about you, but when I look out at this audience, I see the majority of you either needing social care support or having a family member needing social care support. Yet all too often, we wait until that crisis occurs before we start to talk about what would that look like. And indeed, the three reasons for dissatisfaction were people couldn't get the access to the support they felt they needed in a timely manner. If they were involved with somebody working in social care, and we heard how important that role is, pay and terms and conditions was poor, and unpaid carers, you know, the real backbone of care in this country, not being recognised and supported. So for us, coming to your question to me, for us it's about answering all of those questions. It's about having a conversation around what life looks like when life faces the challenge that it often gets described as a health or social care challenge. So what will I do as I get older? When I retire, what am I going to do then? How am I going to fill my time? The harsh reality is I'm likely to die before my wife, just on statistics, nothing to do with her. We're having a conversation. How will she ensure that she doesn't end up becoming isolated, etc.? So some of those, what might seem to be very trivial and simple questions and conversations, we do not have as individuals, as families, never mind as society. Secondly, we need to move away from seeing health and social care being solely or primarily the responsibility of the NHS and local authority. Well-being, which is what we're talking about, is all of our responsibilities. So actually, if you were in Oxfordshire today, the most significant contributor to hospital discharge is Age UK, because they play a leadership role in the discharge hub. They play a practical role in helping people who've got support needs, and they constantly help us professionals challenge our thinking. So it's leadership providing that consistent, constructive challenge to, are we doing enough? And we being us at every level. Leadership in ensuring that environment for innovation and testing is supported. Leadership in ensuring, I was struck by Paul's comment about some commissioners not yet releasing or making a decision on winter funding. It's not my job to support the minister, but one of the things the minister did was ensure that local authorities had money early on this year, the earliest ever. So there is really no excuse for those decisions being left to this point in time. And if we are going to get it right, we need to be making those decisions early on. So there's a little bit of a rant at personal and system level.
Thank you. And just one question that I'll put to Jagdeep before we open it up to the floor. Jagdeep, I was really drawn to your comments about the educational need in terms of managing the conditions and needs of an ageing population. We just had the long-term workforce plan published. I just wondered from your perspective whether that is going to give us the talent pool, first of all, but then actually what needs to change in terms of the reforms. Is it thinking differently about the types of clinical placements that we need? Is it thinking differently about actually how we train and multi sort of disciplinary professional training taking place as early as possible? Just wondered about your reflection on how we enable what you see as a growing need.
No, thanks, Sean. So I think there's lots that we're very positive about with the new workforce plan. But I think some of the things that we do need to think about very carefully are about the needs of the future kind of healthcare users, which do centre around multiple long-term conditions, frailty, cognitive impairment. And so we do need to make sure that the education and training that we're providing, whether that's to doctors, nurses, allied health professionals, and to the social care sector, is aligned to the needs of that population. So we do need to have a more of a generalist approach in our education and training for the workforce. But what we're really enthused about is having a multidisciplinary workforce to be able to deliver that for the future. And we've got a huge kind of opportunity to build on the skill set that our nurses and allied health professionals come with, so that we can utilize the workforce as efficiently as possible. But I think we also do have to be really careful that we don't end up with parallel pathways of care for patients. As we've seen, a patient who might have a heart condition may well also have diabetes, may well also be needing to have an operation. And what we don't want to be doing is seeing those patients in multiple clinics where people haven't maybe kind of put all of those things together and worked out what matters to the patient and how best to achieve those outcomes for that individual, whether that's kind of addressing their symptoms or thinking about the activities that they want to be able to participate in. So I think there are lots of opportunities within the workforce plan, but again, we just need to keep the focus on who is it that needs our healthcare professionals and how do we make sure that we deliver that in the most efficient way possible, keeping the patient at the centre of that. And as we've also heard from Stephen and from Paul, remembering the really important role that the voluntary sector provides within this. Certainly locally as well, we're very reliant on our partners at Red Cross, at Age UK, to be able to support us in delivering care for our population. So again, there will be educational opportunities there for us to work together and bring all of the relevant organisations on board to deliver care as effectively and efficiently as possible. And I think the final point I'd probably have around that is also around patients and their families. We do need to improve the literacy and health literacy of our population. You know, we know that the reading age is still around 8 or 9 across the UK. And then we end up introducing really complex kind of discussions when we're looking at health and social care with our patients and their families. And we need to think about how we support that health literacy to be able to understand kind of the options that we're providing to people when we're looking at healthcare interventions. So there are some broader issues there as well around kind of our patient education within this as well.
Many thanks. We've got just 10 minutes left, so I'm going to group questions and I'll try and do as many as we can. So we'll just wait till the mic comes to you. If we start with the gentleman back there with the blue shirt, and then if you could hand over the mic to the lady behind you after. Name and organisation, please.
Thank you. Councillor Alistair Stewart from Croydon, where I'm also the Deputy Cabinet Member for Finance. 51% of our council's budget is spent on adult and children's social care. 13% is spent on roads, litter collection, planning, etc. It is that 13% that local residents ask us about and that ask us to focus on. And yet, with the changing population, that 51% is going to grow. Is there not a much more fundamental change needed to how we organise our health and social care? Rather than overlaying different organisations to bring people together, what I still see locally is whose budget is paying for this, i.e. is it council money, is it NHS money? And given that need is only going to grow, I don't think it's really sustainable for local councils like mine to become a social care delivery organisation, which is what increasingly we are, rather than what our local voters are actually contacting us about day in, day out.
Thank you. If we take the question from the lady behind you, and then if we take one from over here, so if you just put your hands up.
Hi, my name is Lola Olanwaju. I work in care homes, and I'm also from the Conservative Friends of Nigeria. My question is actually around Living Well with Dementia strategy that started in 2009. That was the original plan, and I think it's been reviewed a few times, but I haven't actually seen the positive impact or the outcome of this strategy, because obviously there have been lots of changes in government, and I don't feel this had been carried over from government to government. So I just really want to see whether there is a policy, or whether the policy will be reviewed alongside, as there's change of government, or there should be a standard policy that we have to follow, rather than changing it when there is change of government. Okay. My other question, is just about how the government is going to support the workforce. It's been mentioned over and over again by the panel, but I would really appreciate if we could have more support in the health and social care sector. Thank you.
Thank you. And perhaps if we take one question from over here, do we have any hands up on this side at all? If not, could we go to the lady in the second row, please? And unfortunately, that's probably going to be the last question we can take.
Thank you. Catherine Johnston from Royal Voluntary Service. We haven't spoken about volunteers, which I know Helen's biting through her tongue to do so. Older people we have relied on heavily over the last 3 decades, particularly because of an exploding population. They have given our civic society and the fabric of our society hope. And actually that's been decimated as a result of the pandemic and everything that you're talking about today. So for me, it's about how do we establish the contract between health and social care, and then create the spaces and places and the roles where the charity sector can play the complementary role and bring the population, as you said, Stephen, the people-powered health, and the understanding of what is on offer from health, what is on offer from social care, and how, quite frankly, you can avoid having to need to use both, I think would be my challenge.
Thank you very much. We have that question on increasing pressure on budgets. Does that necessitate reform? Dementia strategy, comments perhaps on workforce support, and then the opportunities with volunteers. And perhaps rather unfairly, I might ask you to try and weave in some sort of closing remarks, each of you. So perhaps if we start with the Minister.
Okay. So to pick up on Alistair's point about one of the challenges for local authorities across the country, Stephen will be well aware of this from Oxfordshire, is the significant proportion of a local authority budget, if it's a local authority with oversight of social care, a significant proportion of their budget which is on social care, while, as you say, people are very, very concerned about potholes and road maintenance. And I think it is one of the things, and there's sometimes a gap that people don't tend to think about social care until they need it. As more people come across it, whether it's for yourself or for a relative, I think you'll see, and we do see, growing awareness of the importance of social care, but there's still a journey to go on that, of people not necessarily thinking about it until they need it. I mean, so some people will argue that we should nationalise social care and it should be run by the NHS. I genuinely think that local authorities have a really important part in what they do with social care, and their knowledge of their local community is very, very important. And there's a lot of social care which sort of isn't the interface with healthcare. It's what social care does completely independently of healthcare, of helping people to live a fulfilled, independent life, whether you're somebody of working age with disabilities who needs ongoing care, or whether you're older. And I think a conversation, because the topic has tended to be about older people, but we know actually a lot of social care is about supporting people of working age. I think the local authorities have a very, very important job to do. I do think that there is some really, really interesting joining up happening, even irrespective of the different budget lines that you talked about. In fact, I visited Croydon not that long ago and saw this discharge team and actually a really joint team created in Croydon, where you've got working together people who, some of them are employed by the NHS and some of them are funded by the local authority, but those individuals would hardly know which is which and couldn't necessarily say, the person sitting next to them, which sort of entity that they're part of. in a very strong joint team. So I think even with the different budget lines, it is possible where you set up the organisation to truly work together and to really join up kind of at the service level. And I think the more of that, the better. It's one reason why I've been really pushing our systems to work jointly across health and social care in preparation for this winter on planning the needs of each community for health and social care, and to look at the likely demand through the difficult weeks and months of the winter, and to commission in advance that combination of healthcare and social care which will be able to meet the demand. So when Stephen very kindly did mention that we've been sort of planning for winter earlier than ever and trying to get the funding out earlier than ever, and I'm trying to get the systems to jointly say, what do we need across our health and care system to meet the needs of this population, and then let's get the resources according to what the need is. In a really joined up way. Then I wanted to pick up on your question about dementia and dementia policy. I mean, there's a lot going on with dementia. For instance, on the research side and progress being made towards effective treatments, which will make such a difference. We need to get better at early diagnosis, particularly when that means that as we get treatments, it will particularly help when somebody gets an early diagnosis. That'll be really helpful on driving the progress on early diagnosis, and making sure that there are the skills in the workforce, as Judd talked about, to look after older people and actually to look after people with dementia. A very good thing for dementia is in the government's major condition strategy, dementia is one of the major conditions, alongside cancer, alongside cardiovascular disease, given the status that actually those other conditions have in the kind of policy making, which I think is a really good thing. To your care workforce, and I often talk a lot about the care workforce, and actually it's been unusual that I haven't, and I'll have to be brief because I know the clock is ticking. But as Paul actually alluded to, I do a lot of work, and government's doing a lot of work on boosting the recognition of the care workforce, and working on a care workforce pathway to develop the careers path for people working in social care, frontline care workers, to identify and formalise the skills that you have as you gain experience, investment in a new care certificate and in training to help people develop their skills. So to me, we're on a journey of going from currently a job which too many people will find, even if they've got 20, 30 years experience, that's not being recognised, or extra skills, to actually get to something which there is a career, and you can start off in social care, and it's a job that you want to do. You might want to do for life because you'll make progress through it and really be appreciated and recognised for what you do. And there was a Catherine on volunteers. I mean, to me, getting the system to join up and using people of a mix of professional skills and volunteers who actually also bring skills is really, really important. We've opened up the volunteering, the service that we developed in the pandemic. NHS volunteer responders. Sorry, no, I was like, NHS volunteer responders to social care. So I would say anyone from a social care organisation, do go and look at that and sign up, because we've got people signing up who want to volunteer in social care as well as in healthcare. This is a great opportunity. There's also work going on to kind of formalise what are some of the roles that volunteers can do with health and with social care, so that it's kind of almost easier for the sort of professional, the sort of paid bits of the system to work with volunteers, because well, that's a thing that a volunteer can do. So there's some practical steps to help volunteering work, which, as Catherine knows, I'm a great fan of.
Many thanks. So perhaps if we go to Stephen and then to Jagdeep, and then I'll give the final word to Paul, and unfortunately I will have to ask you to be pretty prompt.
Yeah, no, thank you. So Alistair, I wouldn't, I don't think you said it like this, but I perhaps heard it like this. I wouldn't see adult social care as being the millstone around your council's neck, but rather it reflects the investment that you're putting into some of the most complex and valued individuals in your council. So I think one of the tools that I referenced earlier is the opportunity to pool budgets. So some councils and NHS bodies have made really great use of that. So we pool £500 million in Oxfordshire between the NHS and the council. And what that allows us to do is to remove some of the arguments that we often had over who was responsible for them. It also allows us to fund some of those services that would have been really difficult to fund on an individual basis. And it helps us with some of the fantastically efficient services that we've got, whether it's commissioning and purchasing care home places, whether it's our discharge hub, etc. So I would say to you, I'm a fan of integration, but I am absolutely not a fan of the NHS being responsible for social care for the very reasons that the Minister said. Social care looks after, social care enables people to live good lives, not treats conditions. So, lean forward on that one rather than worry about everybody who's going on about potholes, etc. Just finally then, you mentioned, Lady mentioned the issue of dementia. I am really concerned about the support that people with dementia and their families get, because I think it's an area that we've lost a little bit of the momentum of, yet they are a group of people that are growing exponentially year by year, and they're a group of people who deserve much better than we're often able to do. So that's something I'd be really keen to see us develop further as we move forward.
Many thanks, Stephen. Jagdeep, final word from you.
I think kind of what Stephen's really highlighted there is how that we, again, have examples of where this is working really well. So, there's clearly opportunities for learning between Oxfordshire and other counties to see how we can integrate our budgets to be able to deliver better care for our populations. But I think the other thing kind of within that, of course, is the issue of the voice of older people and making sure that that is being heard loudly and clearly, considering that they are such a large proportion of our communities who have contributed meaningfully over their lifetimes and continue to do so as volunteers, as one of our other questions kind of also alluded to. So making sure and supporting older people to have that voice, which Paul and Age UK do so well, and kind of making sure that we're addressing those concerns through our joint efforts. I think one of the interesting things, kind of just reflecting on the conversation so far, has been the fact that I've done a ward round this morning of 28 patients, 22 of whom are waiting either for equipment at home or carers to be kind of start up supporting them at home, or a care home. And I think that just really illustrates the difficulty that we have in disentangling health and social care. And I think we still haven't really bottomed out this kind of conversation around kind of the extent to which we integrate these budgets or not. Because at the moment, that's having a huge impact on us as clinicians, being able to deliver healthcare when we're not able to support people with the social care that they need out in the community. So I think there are certainly kind of issues there around integration and how we progress that. In terms of the dementia side of things, I think, again, Helen's kind of really illustrated the fact that, we are pleased that this is featuring so much more at the forefront of national strategies, such as the multiple long-term condition strategy in the research agenda. But again, prevention has got to be a strong kind of issue that we take up around dementia. We know that so much of dementia is related to smoking, sedentary behaviours, and kind of poor nutrition as well. So there are things that we could be doing there better. We do have policy documents that can support care homes to deliver better care for people living with dementia, and a number of these resources are available at the British Geriatric Society website. So I'd certainly urge the lady to have a look there and see what we can support with from the organisation. And so I think those are probably some of the kind of themes that I'd like to kind of pick up from that, is the continuing difficulty that we have around disentangling health and social care and having to rethink the way in which we do deliver this for the future.
Many thanks. And the final word to you, Paul.
We need to describe better what happens now so that the Alistair's constituents and the rest of the wider public can understand what actually happens for older people in the here and now, including the patchwork quilt of support that is generated by dedicated professionals and volunteers who help make older people's lives better than they would otherwise be. We then need to describe what we would like the world to look like in the future, and whether it's a plan or a service framework or a 5-year forward view, I think the time is coming for that, for an older people's, a clear older people's plan that we can work with ICSs to help implement. And then we need to know clearly how well we're doing in that by asking older people what their experiences are.
Well, many thanks, Cormac. Thank you for being so prompt. And apologies for overrunning a little bit, but I think that's testament, as you said, Paul, at the beginning, to thinking about how we're going to deliver for the punk rock generation. Just to say a massive thanks to Age UK for their support of this panel, and please do join me in thanking all our panelists, and clap extra loud for Jugdeep so she can hear.